Feel like you're bombarded with health advice. Every single day, it's new study this, superfood that. It's exhausting trying to keep up.
Oh, tell me about it. It's like you need a PhD just to sort through it all.
Right. So today, we're doing a deep dive into 16 issues of the Bionic Health newsletter, going all the way back to February.
We're talking months of insights from some of the best in the field.
Exactly. Dr. Jared Palo, Dr. Catherine Isaac, they're sharing some really cool advice, and we're going to break it all down for you.
Consider this your cheat sheet to, well, a better you.
Love that. So let's start with the basics, the foundation. What do these newsletters say about building like a baseline bionic lifestyle?
Okay, so you know how the saying goes, can't build a house on sand? Same with our health. Sleep and nutrition are everything. And there's this interesting challenge in the newsletters called the 800-gram challenge.
800 grams. What is that, a weightlifting contest with a giant cauliflower?
Not quite. It's about eating 800 grams of fruits, veggies, and legumes every day.
Every day. That's a lot of produce.
It is, but the payoff is huge. We're talking lower risk of heart disease, stroke, even some cancers. The newsletters mention a bunch of studies.
Wow, okay. That's a pretty compelling reason to up my veggie game. But speaking of upping things, these newsletters also talk a lot about protein. Why is that so important?
Protein is how we build and maintain muscle. And as we age, that becomes even more important.
Makes sense. So how much protein are we talking? Like, how do you even figure that out?
They actually give a really simple equation, 0.8 grams per pound of body weight.
So if you weigh 150 pounds, that's
120 grams of protein a day.
Got it. Math skills still intact.
See, we've got this.
Okay, now, for a topic I know I personally need help with, sleep. What do the Bionic Health gurus say about catching those Z's?
They have this cool little thing called the 3-2-1 rule. 3 hours before bed, you stop eating and drinking anything but water.
Okay.
2 hours before bed, you shut down work, anything mentally stimulating.
No more scrolling through social media.
Nope. And then 1 hour before bed, all screens off.
So that means TV, phone, the whole shebang.
Everything.
I like that. It's actionable. It's not just sleep more. It's here's how W to actually make it happen.
Exactly. It's about, turning that knowledge into action. And speaking of action, let's talk about some of the things your doctor might not be telling you about.
Okay, now you've got my attention. What kind of secrets are we talking about?
Ever heard of something called LPA? Lipoprotein little a?
Can't say that I have.
So imagine your arteries are like pipes, right?
Okay, I'm with you.
LPA is like this sticky sludge that can clog them up. And high LPA basically sends your heart attack risk through the roof, even if your cholesterol looks fine.
Wait, hold on. You're telling me I could have this sticky sludge building up and not even know it?
It's possible, yeah. Standard cholesterol tests don't always catch it.
Well, that's terrifying. How common is this LPA thing anyway?
The newsletters estimate 10 to 20% of people have genes that make them prone to high LPA, which basically doubles their heart attack risk.
Okay, note to self. Get tested for LPA. What else is lurking in our blood work that we should be aware of?
You've probably heard of VO2 max, right?
Yeah, isn't that like a fitness thing?
It is, but these newsletters argue it's actually the master biomarker. It tells you way more than just how fit you are.
Really? Like what?
It shows how well your body uses oxygen, which is a marker for your cardiovascular health, how well your cells are aging, all sorts of things.
So higher VO2 max is better.
Absolutely. Means your body's running like a well-oiled machine.
Okay. You've convinced me. I need to find out where to get my VO2 max tested.
Bionic Health actually offers it through their platform. Super easy.
There you go. Actionable steps. I love it.
Right. All right, let's talk heart health for a sec. Specifically, calcium buildup in your arteries.
Isn't that what causes heart attacks?
It can, yeah. Doctors use two main tests, calcium scans and angiograms.
What's the difference?
Think of a calcium scan like a quick snapshot. Just sees if there's any buildup. An angiogram is more like a 3D map, shows exactly where and how much plaque you have.
So angiogram is more detailed.
Way more. Another thing that often flies under the radar, APO.
APO what now?
Apolipoprotein. Basically, it's a protein that loves to attach itself to cholesterol.
Oh, no.
Yeah, think of it like the glue that helps form plaque in your arteries.
So high ApoB, bad news bears.
You got it. Newsletters say it's a better predictor of heart attack risk than standard cholesterol tests, actually.
Wow, okay. Starting to sense a theme here. It's like our bodies are these mysterious landscapes. We're just starting to figure out the map, you know?
Right. And even with all the fancy technology, there are still some blank spots. Speaking of blank spots, the newsletters talk about some blind spots in modern medicine.
Oh, like what? Spill the tea.
Well, one that really stood out to me was the conversation about hormone replacement therapy, HRT.
HRT. Yeah, I remember back in the day, it seemed like everyone was warning about the risks.
Yeah, there were those early studies linking it to cancer, blood clots, the whole 9 yards. Scared a lot of people off, especially women.
So is HRT good or bad? What's the verdict?
It's complicated. Seems those early studies might have jumped the gun a little.
How so?
They didn't always factor in things like age, overall health when you start HRT. It turns out those things matter a lot.
So newer research is saying.
Newer research is saying it's not so black and white. There are potential benefits, A&D risks. It's all about weighing those for each individual.
So talk to your doctor. Got it.
Exactly. Don't just rely on what you heard 10 years ago,
Okay, good advice. What else did these newsletters call out? Any other medical mysteries we should know about?
Well, they had a whole thing about the overuse of antibiotics.
Oh, right, the whole superbug situation.
Exactly. And a lot of it comes down to, overprescribing. Like giving antibiotics for things that aren't even bacterial infections.
Which is what, like half the time you go to the doctor with a cold?
Pretty much. And the more we use antibiotics, the less effective they become. We're basically breeding these superbugs that laugh in the face of penicillin.
Okay, so what do? Just suffer through every sniffle and cough?
It's more about being, mindful. Talk to your doctor, ask questions. Don't be afraid to push back a little if you don't think an antibiotic is really necessary.
I like that. Channel your inner skeptic.
Exactly. Question everything. Speaking of questioning, did you know there's a growing movement reconsidering whether we always need surgery for appendicitis?
Wait, really? You mean that thing where your appendix explodes and you need emergency surgery?
Okay, it's not always an explosion situation, but yeah. Turns out, for some cases, especially uncomplicated ones, antibiotics alone might do the trick.
No kidding. So you could potentially avoid surgery altogether.
Potentially. It's still being studied, but it just goes to show what we think is set in stone in medicine. Well, sometimes it's more like shifting sand.
Mind blown. Okay, so we've covered a lot. We've got the foundations of health, the scary stuff hiding in our blood work, and now we're challenging medical dogma.
Right. We're like health detectives over here.
I like it. And it feels empowering, like having all this knowledge put you back in the driver's seat.
100%. And speaking of empowerment, these newsletters are great because they don't just point out problems, they give you solutions.
Okay, yes. Solutions. After all that doom and gloom, let's talk about what we can actually do to, live our best lives.
Right. So the big takeaway is lifestyle is medicine. The choices we make every day, what we eat, how much we move, it all adds up.
It really makes you realize how much more there is to learn. Like this whole health and longevity thing, it's a moving target.
Totally. What we think we know today could be totally different tomorrow. It's exciting, but kind of scary at the same time, right?
Oh, absolutely. But I'd rather be informed than, blissfully ignorant.
Hey, knowledge is power, especially when it comes to our health.
So true. And we've covered a ton of it today. If our listeners could only take away one thing from this whole deep dive, what would you want it to be?
It's a tough one. I think for me, it's the reminder that small changes can make a huge difference. You don't need to overhaul your entire life overnight.
Yeah, that can feel so overwhelming.
Right. Just pick one thing. Maybe it's trying out that 3-2-1 sleep rule we talked about.
Yeah.
Or adding an extra serving of veggies to your dinner plate.
Small steps, big impact. I like it. What about you? What's one thing you're going to try after digging into all these newsletters?
Honestly, I'm already pretty good about sleep and exercise. But that 800-gram challenge?
Yeah.
That one's calling my name. I love my fruits and veggies. But 800 grams a day, that's a whole other level.
It's a good challenge, though. I'm thinking about finally getting my VO2 max tested. Kind of intimidated, but also, weirdly curious to see what my number is.
There you go. That's the spirit. It's about finding what resonates with you and taking that first step.
Love it. Well, this has been an incredible deep dive. Thank you so much for, geeking out on these newsletters with me.
Anytime. Always fun to talk shop, especially with someone as enthusiastic as you.
And to our listeners, thanks for joining us on this journey to better health. Remember, every step you take, no matter how small, it all adds up. Until next time, stay curious and keep exploring.